I have several questions to ask, and forgive me if I repeat one that's already been asked. I guess one thing that I was wondering, if you could clarify, there's been a lot of discussion about schools today, but could the minister clarify the impact? Well, I guess could the minister clarify if this is just for students in schools, or if this this change will impact all New Brunswickers?
For the question, member, these changes are with respect to schools only.
Thank you for the answer. I'm wondering what exactly will be tracked in terms of vaccinations? Will it be all vaccinations that a student would have received, or just certain ones?
Thank you. It tracks only the publicly funded vaccinations.
And I'm also wondering what if there's a cost associated with the implementation of this legislation, and if so, if there's an estimate of what the cost might be.
Yeah, the actual cost of legislation, introducing the bill and everything, it's the program. I think that's what the member's interested in, the underlying cost of the program. It's a $10 million project funded by Health Infoway, which is a funding vehicle. It's funded by the provincial government, the federal government, and it's a combined project of those levels, and it is about a $10 million project. And again, my judgment, it's well worth it, because to go through all of this manually, which is what public health is doing now with the measles issue, is tracking everything down manually, person by person, list by list, and all this stuff, paper application. To be able to just have this information is just tremendous. And to use the words of Dr. Russell, it takes us out of the dark ages and brings us into the 21st century in terms of health management, disease outbreak, and vaccination.
Thank you, through the chair, to the minister for the answer. I'm wondering if this legislation and this system that's being set up is similar or based on a similar system or policy that exists elsewhere.
Yeah, it's an electronic record for public health outbreak management. And again, there are protocols that are in place throughout North America and the world with respect to dealing with outbreak management. This isn't new and unique to New Brunswick. It is best practices, which has been done in other jurisdictions around the world. It is similar to what is being done in Nova Scotia, other provinces, and the United States. And I'm pleased to say that we do consider it to be best practices in terms of managing this kind of situation, dealing with the electronic records so that outbreak can be tackled quickly, efficiently, with all the data that we need. So again, we're not sitting here inventing the wheel in New Brunswick. There are protocols that are tried and true, used, successful, and exist in other jurisdictions. What we're doing, it's not anything necessarily new, but we're catching up so that we can consider ourselves to operate best in class, as opposed to, gee, I wish we had this.
Thank you for the answer. I'm wondering if the minister would be able to let us know the timeline for implementation of the new system.
Thank you, member. It's a 2-year project, and right now we're pretty much halfway through. And so the 2-year project that was brought in, as I say, we're about the halfway point, and this is part of that process that'll take us the other half, so that I would hope that within the next 12 months the program will be fully implemented.
In the legislation, there's the immunization registry and there's also the notifiable disease registry. I'm wondering if, through the chair, I'd like to ask the minister to explain the difference and specifically to explain the notifiable disease registry, please.
Yeah, there's 3 aspects to the program. The first being inventory, registry, and tracking. You want to know how much inventory you have and how you track it, how much you've used, how much you need, so that you can control your inventory. Right now, that's been implemented. Prior to that, it was very inefficient. Manually tracking of inventory is tedious, paperwork, complicated, and things like that. The second aspect is the registry, which is the subject of this bill, which is registering, making sure that public health and education have access to each other's data. And then the third, which is yet to be implemented, is in dealing with the subject of outbreak management. So when there is an outbreak, similar to what we're experiencing now with measles, the data will be there so that you can quickly, efficiently, and effectively manage that outbreak, so that you can contain, know exactly who hasn't been immunized, deal with it, and make sure that it does not spread beyond the original outbreak. So those are the 3 sort of pillars to the program, and that pretty well covers the 3 aspects.
Through the chair to the minister, thank you for outlining those 3 pillars. just to clarify a bit on the language around that second one, around the registries, under 42.3, there's immunization registry, and that language seems fairly clear to me. I'm wondering if the notifiable disease registry, I'm sort of wondering the difference between those two, and notifiable disease isn't a term that I think people have heard a lot. I'm wondering if we could have clarification on that, please. Thank you.
Although it may not be known to the general public, me included, but the notifiable diseases are information that every physician has in their office, that they have received notification of that from public health, so that they are always current, knowing exactly what they have to deal with at any given time. So the primary health care provider would be provided regularly with the notifiable disease list, so that they're on top of it at all times.
Thank you for the answer. So to clarify a bit more, that list just contains a list of certain types of diseases that are present in New Brunswick, communicable diseases. That would it just be a list, or is there any personal information tied to that list?
Yeah, the Public Health Act says the doctors must report on these particular diseases because they're on the front line and they would know, and then they would report that back, and it would be from that collection. Frontline primary health care would go back, and that's what the list would be based on, and then everybody would be notified about it.
Okay, through the chair to the minister, thank you for clarifying a bit how, the notifiable disease registry. Let's see. I'm wondering about the information that will be shared. There's various things here outlined for the immunization registry, and I understand that that may be collected. There was the language of without individuals' consent. I'm wondering if that could be clarified a bit, and even if someone were to not give consent, it could that information be collected, and if so, would they be made aware even if they don't consent?
Yeah, for public health reasons, because the safety and the health of the population is paramount over the individual consent. Sometimes the individual consent is not necessarily going to be obtained. I mean, I'm a fairly libertarian type of guy, believing in, individuality and rights and things like that, but there are times when the greatest good for the greatest number has to carry over that individual consent, and this would be, in my judgment, one of the rare cases when that should occur. Because what we're talking about here, although individual liberty is very important, preventing the spread of disease to innocent people is also equally important. So in this particular case, consent would not necessarily be had in order to share that information.
Through the chair to the minister, thank you for explaining that component of it. And to clarify on, even if someone doesn't give consent, would they be made aware that their information is being collected against their consent?
Yeah, when a student is registered in the public schools to start, they sign a consent and they provide the immunization information when they register. That consent is clear that that immunization information will be shared with public health for the purposes of verification in the event of disease outbreak management.
Okay. Through the chair to the minister, thank you for that. I guess so. I guess in the act of someone signing or not signing, they would be made aware that, well, even if you don't sign this information about your child may be shared through this system. So I guess to move on, although related to that, I'm wondering, is there, and maybe this legislation is just really narrowly focused on the information sharing, but I'm wondering, is there sort of an education or public awareness component related to any of this? Thank you.
Yeah, this was one of the first things I did as health minister, was announce this program. We had communications, press releases that this was occurring. People were encouraged to participate and get involved with it. It is being done now at the entry level at school, so more and more people will become aware of it. And I think you're right, and the more people you tell, the better off we're going to be. And I think the member is quite correct in saying that this is the type of thing that is a tremendous tool for, it's 21st century medicine. It's electronic data, it's records, it's information, and it is the timely, effective access to that information which enables people like Dr. Russell and her team to work most efficiently, effectively, and quickly. So I agree with the member. The communication of this is a good story, and the more people know about it, the better off we all are.
Through the chair to the minister, I'd like to ask a question about sort of, I guess, how this is going to apply to I guess, students who had previously been in school or going forward, if they're sort of grandfathering in. Could the minister talk a bit about the transitional provision?
the system was originally contemplated to capture entry-level grade 1 school. But with the recent events and the amount of information that we're getting, the amount of immunizations that we're doing now as we're dealing with this outbreak management, the more data you have, the more data that gets put into the system, the better off we all are. So again, originally it was intended to be entry level, but under the circumstances, it is a larger public health issue, and every piece of information that public health has empowers public health to fight disease that much more effectively.
To the minister through the chair, I'd like to seek a bit more clarification on exactly what the minister just said. So it was intended for just as students were entering the school system in grade 1 or kindergarten, I guess, to be entered. So to clarify what the minister just said, does this mean so all students who are enrolled will have their information entered to sort of to catch up and grandfather in students? And I guess then that begs the question as well, do students get entered when they enter the school system at at another grade level other than just entering at grade 1?
The program was originally set up and is set up to collect essentially kindergarten entry data. However, as the member pointed out, what additional information is, and that, that's a good question. So in addition to kindergarten entry data, also inputted into the system would be all existing public health information, plus all new students coming to New Brunswick and going to our schools, regardless of what grade that would be. They would be added into the system. Plus, public health does have an extensive amount of existing manual information. And that manual information over time will be added to the system as well, so that as many pools of data as possibly can be compiled, so we have the type of information necessary to enable public health to carry out its functions in the event of outbreak management. So it's more, as the member queried, it's more than just kindergarten entry, although that's what it was originally set up for, but these other additions also will be made.
Through the chair to the minister, thank you for clarifying. I guess I heard all existing public health information. I just want to clarify, is that just for students?
That was my, it wasn't all, it was all existing immunization records for students.
Okay. Thank you for clarifying to the minister. I guess I want to ask another question in relation to this type of information being put into electronic records. I believe that there is value in that, and I guess it doesn't matter just what I believe. Public health officials believe that as well, so that it's easier to navigate that information. However, there have been issues around privacy and around issues of how the information that is collected about people can be used, and I know that's something that is top of mind for many people these days. And I understand that this is public health information. It's different from some of maybe the more private information that gets collected, but there are stories out there of, you know, people wearing Fitbits, and then their company has that information, and then maybe it can be used against them. An insurance company could use that information to not provide coverage. And I understand we're dealing with the public realm here, but I'm wondering if I'm sort of looking for any possible unintended consequences that might be there, and what privacy, like, have these been thought of, and sort of how will people's privacy be protected? Are there any potential negative outcomes from this type of legislation?
That's a good question. Again, you know, whenever you have information like this, you want it to be private and unique for the purpose for which it was intended. So this information would be subject to all of the privacy legislation that exists in Canada today. It would be subject to the Personal Health Privacy Act, which is the law of the province with respect to the confidentiality of medical records. And so every effort has been made to put in the checks and balances that you are referring to. There is existing legislation in place for that would prevent the dissemination of this information for purposes other than what it was intended.
Through the chair to the minister, thank you for the answers. I believe that's all the questions I really had. I guess to finish up, I want to just comment that I do think that the use of technology is a positive step in the right direction. Obviously, there need to be safeguards and respect for people's rights, which, you know, is part of the laws that exist. But we need to be providing the tools to public health to be able to protect against outbreaks. And I mean, obviously, there's one happening right now, and there, as the minister has referred to, this type of system would have been very handy. So I think that's the end of my questions on Bill 33. I want to thank the minister and staff through the chair for their time. Thank you.
Thank you, member. Recognized.
And thank you for your questions. They were sincere. They were in the interests of informing yourself, your constituents, and the public. And it is, as always, a pleasure dealing with you and having your questions, which are motivated by your research and your sincere interest to operate in the best interest of the people of New Brunswick. So thank you.
Member for Miramichi.